I am Nicole Scholden with Ohio Families Can, a group of parents who've come together working towards the opportunity to legally access medicinal cannabis for our children. We've been working for 2 years engaging with our elected officials on the topic. We recognize that the issue of access to medical cannabis is a complex one that challenges nationally accepted protocols and deeply held societal values. I come today seeking solution to a problem that may not be fully understood yet from our perspective. We think that the solutions to this issue will not be found in the extremes, but within reason. Before I begin, I need to introduce you to Lucy Scholten. If I may I?
Sure.
There she is. Because she's why I'm here. She's a kid who started having seizures very early in her life. She's 12 now, but her first EEG, picking up seizure activity, was done when she was 5 months old. She is a profoundly physically challenged kid, maybe more profoundly physically challenged than anyone you've ever met, but I promise you that her epilepsy causes her greater strife than her cerebral palsy. People with CP learn and they live and learn, but Lucy is a kid who has hundreds of daily seizures, and that interrupts all of that living and learning. All the good stuff is interrupted by hundreds of daily seizures. I am here representing many. 54 families within OFC, which if they are not, you're wondering why they're not constantly storming the castle on this topic, it's because that at any given time, someone in our ranks is hospitalized or dealing with significant sickness. I also come representing my greater community of loved ones. Liberal, conservative, young, old, people of faith, so many of my loved ones and our loved ones in OFC feel that we are unreasonably restricted the right to trial what is known to be a safe, non-toxic, plant-based medicine that is currently improving lives in 23 other states. So one of the first things I'm going to ask you to do today is tap into your empathy. I would ask you to imagine yourself at home with a kid who is chronically sick, one who has already taken some pretty heavy-hitting drugs. My husband first injected my daughter with steroids, ACTH, when she was 5 months old. It didn't help her, of course. In fact, it turned an unhappy child into a ragingly unhappy child. The 12 invasive drugs and treatments that followed also have failed to help her and came with horrible side effects. Side effects like the need for oxygen, regular blood draws to test for liver toxicity, loss of body function. This is why I'm here talking to you today. And this is consistent with all of the families within Ohio Families Can. There is no treatment that has worked for Lucy. I've heard people say, I just can't believe there's no better medicine for kids with seizures than marijuana. And to that kind of statement, I would say join the club. The fact is that for roughly 1 million of the 3 million Americans with epilepsy, current treatments do not work. It's enough of a problem that there is actually a diagnosis for it. Lucy has intractable epilepsy, which means drug-resistant epilepsy. So again, please put yourself in the shoes of a parent desperate to find a treatment that is effective for a catastrophically ill child. Doing so will not cloud your judgment. I believe it will make it more clear. We are parents. We are not scientists. We are not doctors. But I'm going to talk tonight about some things from our perspective that some people might say you need a scientist or a doctor to speak about. Because I believe that we have something to offer to the conversation about issues like FDA approval, safety, and civil rights. These are things that stand between our children and the promise of effective medicine. The issue of the FDA is one that really strikes a chord with people. It's one of those commonly held, accepted practices. And I will stand here in agreement that it is a valuable body for our country, our nation. Of course, policymakers and medical professionals would appreciate an organization of that sort that would create structures of safety, of course. Of course, patients want the highest levels of knowledge and information about any substance that they choose to use or give to their children. But here's what's happening from our perspective. State officials have said to me, until we have FDA approval, I can't help you. And many at the federal level say, let's wait and see what happens in the state laboratories. Both of these bodies of government, as we see it, pushing off responsibility of acting on behalf of the people they work for, who are saying loud and clear, we are currently without effective medicine. So we see that the FDA is failing families like ours in that process. Please don't take my word for it. Dr. Orrin Devinsky, responsible for one of the first promising Epidiolex trials, has stated the same. Two Brookings Institute scholars recently wrote a paper outlining how our federal government has systematically impeded research on the efficacy of medical cannabis. They point to statutory, regulatory, bureaucratic, and cultural barriers that have paralyzed science and threatened the integrity of research freedom in this area. They point to the fact that much of our U.S. healthcare, from this perspective or by this plant, is inconsistent and often contradictory from case to case and state to state. OFC families feel that the FDA approval process is not working in our favor. When we are very aware of the fact that parents in 23 other states are afforded the civil right to trial a promising, safe, non-toxic plant-based medicine. I'm going to say something that may cause gasps, but I'm going to say it anyways. I also offer that the FDA approval process is but one way to know the effectiveness of a treatment, because parents are resourceful. When we don't find success for our children within the scope of accepted medicines, we will look elsewhere. We will do research. We will connect with other parents. While OFC appreciates and agrees that we should be moving towards the highest levels of study and knowledge about whole plant cannabis as medicine, the notion that our children should wait a decade for effective medicine in the meantime is unacceptable. I believe I believe any parent would feel the same. Evidence. I've noted that medical cannabis is showing promise. We know this because of a growing body of scientific evidence from around the world. I mentioned Orrin Devinsky's trials. One of the earliest report a mean reduction in seizures from his participants of 50%. That's a pretty big deal in the epilepsy world, considering a kid didn't get into those trials unless they had difficult to treat epilepsy. I want to be clear, however, and state that our families recognize that Epidiolex is but one solution, and that isolated cannabinoid therapy alone would limit the potential promise of cannabis medicine and leave patients behind. And we would therefore not support a partial plant bill. We also know, because as I've said, it is currently improving the lives of children in 23 other states. These are called case studies, and we look to them because they're meaningful to us. The accounts reported by parents and caregivers of children receiving cannabis in legal states point to not only significant decreases in seizures, but decrease in severity, cognitive gains, bright eyes, and alertness. Children speaking and walking with notable progress. Children and families living life where they were unable prior. Effective medicine where there was none. I would also like the substantial accounts of those parents to be recognized as valuable. There are those that question, is it really true? Those parents, they don't know. We know. Suggesting that parents want cannabis to work and therefore think it does. I will submit to you that this is a group of people I know personally that understand what a failed medicine looks like. They have tried dozens, yes, hoping, but also carefully observing. Still, one does not need careful observation when a child's seizures go from 300 to 10 or 0, and that is happening in legal states. Nor do massive numbers of families uproot their lives to other states and stay there without the results they've been waiting for. I consider this substantial lack of gold standard research. When I'm considering it, I think that I would love to see Ohio join the world in answering the much needed research questions. I would love to see Ohio State medical and agricultural schools become centers for discovery, because what I suspect is that there are already patients in the state of Ohio successfully treating their difficult disorders with medical cannabis, and that someone should be learning from them. Is it safe? Well, OFC families are not afraid of psychotropic THC. You see, we are people who have given opioids, benzodiazepines, and bromides to our babies. Cannabis is far safer than those medications that they have been prescribed. And I promise you, they get our children high. This is why context is so important in this discussion. Many don't understand that our children have run out of FDA-approved treatments, while cannabis has helped kids who have lived long lives of never being helped before. We deserve that right here. So what we're asking is that you support action in a timely fashion so that Lucy and this decade of Ohio children can appreciate benefits. Let us stand with the compassion of the American Academy of Pediatrics, who just a year ago published a statement recognizing cannabinoid therapy as appropriate for our children with life-limiting disorders. Unequivocally, they said, healthy teenagers should not be smoking cannabis. How much evidence must there be for a national medical organization serving children to make such a statement? They didn't do it lightly. They surely could have left it out, but they included it because it can help people. What I hope to leave you with, as you gather information on the topic of cannabis therapy, is an understanding that status quo protocols and extreme positions will not tell you everything you need to know. You will need to delve deeper and unpack some commonly held beliefs in order to do right by Ohio children in need. A well-respected oncologist, David Abrams, has said, if we were to discover this plant in the rainforest today, we'd be clambering over each other to make use of it. But It just so happens that there is a long history and campaign of stigma and misinformation about cannabis. Children like Lucy require us to look at this issue with a more in-depth lens. And that may challenge some of our deeply held notions and accepted practices. So please work with us. It will be good for all of us. If you do not, I promise you will lose more Ohioans to legal states, and you will foster an environment in which good, law-abiding parents become criminals. If that is not a reason to reconsider public policy, I don't know what is. The families of OFC would like a continued opportunity to help further share our humble yet educated perspective. We look for action to follow these task force meetings. And we welcome an opportunity to support meaningful medical cannabis legislation from our State House because we feel that it is best suited for the job. But know that State House action and willingness to keep us engaged, or not, will affect our behavior. Thank you so much for your attention to this matter.